Hello and welcome to this mini symposium. The title is Abilities-Oriented Approach Towards Disability, Research and Clinical Projects Modeling a Positive Language, specifically featuring the Accessible Care Pregnancy Clinic in Ontario, Canada. We are grateful to the European Academy of Childhood Disability for the opportunity to share this symposium with you. I am Schiariti and I am joining from the west coast of Canada in the province of British Columbia. And my colleagues Anne and Haley are going to share their presentations from the Sunnybrook Health Sciences Center in Ontario, Canada. The theme of this meeting is From Childhood to Adulthood with Disability, and we think that the topics of our presentations and this mini symposium aligns with the theme, and we celebrate that we can collaborate with professionals working in adult disability clinics, and this is going to be an example of that. And we hope that in future meetings there are more opportunities to share presentations like this one. The objectives of these symposiums are to introduce research initiatives highlighting an abilities-oriented approach to disability service provision, and I am going to focus my presentation on the first objective, and to demonstrate the impact of creating positive clinical programs for pregnant women living with a chronic health condition or disability. And finally, to promote collaboration between professionals working with pediatric and young adult populations, facilitating successful transition to adult care. The symposium we're going to organize following 3 presentations, and each one of us has 20 minutes, and then we will open for questions, and we're going to join you live, and hopefully we have a lively discussion. So the topic of my presentation is abilities-oriented approach towards disability, research and clinical projects modeling positive language. I have no conflicts of interest to disclose. A systematic application of an abilities-oriented approach will increase communication between professionals and individuals with disabilities. And most importantly, it will change the societal perception about the capacity of people with disabilities, showing the power of using a positive language. I want to use the ICF and the UN Conventions on the Rights of the Child as the guiding framework for this presentation. The biopsychosocial framework of the ICF promotes a positive language, and many of you are familiar with the content of the ICF and the model, but I want to highlight the construct of functioning that invites us to think about abilities and strength. So functioning is a concrete way, in my opinion, to describe health, what a person with a health condition is able or can do every day. So what they can do every day is what is the most important things for them. So we should really focus on functioning and using a positive language describing their abilities. So as you know, functioning captures the interaction between different components of the ICF, and body structures and body functions, activities and participation, and the interaction with contextual factors, environmental factors, and personal factors. It's important to know that we are part of that environment. And so if we change our attitudes and we change the language and our attitudes, that will affect directly functioning of people with disabilities. So just to mention some of the environmental factors that are included in the ICF are the family, the friends, the playgrounds or the environment, the physical environment that surrounds us, and the children as they grow, and the healthcare team. So this particular invitation is to think about, what approach and how we use and how we address the needs of people with disabilities, and the importance of using a positive language. So why is important thinking or adopting the ICF? The ICF encourages the identification of strengths and functional goals, promoting abilities-oriented approach in healthcare encounters, and I want to emphasize that as we go. Why is important in pediatrics? The ICF incorporates the fundamental human rights of persons with disabilities and the international conventions on the right of the child. So it's important to be aware that when we use the ICF, we're incorporating the conventions on the rights of the kids. In addition, the ICF promotes family-centered care by including the family as an important environmental factor, as I mentioned before, highlighting the role of the family in the child's functioning. And in addition, personal factors encourage the systematic inclusion of the preferences and interests or priorities of children relevant to their general functioning, so everyday functioning. It's important to think about the patient's value and the patient's oriented research, and you're going to hear more about specific examples on to the next presentations. But I want to highlight that it's important to set meaningful research questions from the beginning in a collaborative way. So ask, the population that you are interested in studying to be involved from the beginning and trying to answer questions that are really relevant for them. Use of proper terminology, and I'm going to invite you to think about my abilities first. And using that approach, and participation from the design of the study to disseminations of results. So we're trying to follow those guidelines. An abilities-oriented approach, and how I started thinking about this and trying to focus on abilities first. This was a result of one of the qualitative studies that we published in 2014 in the Developmental Medicine and Child Neurology. It was guided by the ICF, and the goal of the study was to identify what functioning means for children and families. So what they understand and what they want us to know about what they can do and what they value every day. So the results, they really focus on abilities and facilitators. When we ask the kids if they could describe what they do, what they can do, what they are interested in every day, the focus of their descriptions were always based on abilities and positive language. So that's how I started, and the next project that I want to share with you, it was based on the learning from this study. My abilities first. Why do we need a different approach? So traditionally, services for people with disabilities were planned based on what was wrong and what they could not do. So most of the traditional change-focused interventions that follow when the needs that we identify sustain that people needed services because they had a problem. And you might be aware of the tools that you use in clinical practice, that most of the tools available today focus on proxy descriptions of limitations and deficits, as opposed to an abilities and or strength-oriented approach. So I propose that a shift in the disability paradigm guided by the ICF and how needs are identified is required. This is show the publications today. I did just a quick search about children with disabilities and the word limitations. And in seconds, I got almost 2 million hits. These are all papers, peer review papers or published in the literature. So this is Google Scholar. When I search for children with disabilities and abilities, I got less than half of papers describing or using the word abilities in those papers. So almost 40% of the papers. So that's reflect what we're doing, what we're studying, and what we're interested in. So I think we have to pay attention to this and change the approach. Why abilities or strengths are important. In clinical practice, assessments and evaluations applying an abilities-oriented approach ensure personal empowerment. An abilities-oriented approach helps establish an equal power relationship between the child or youth or adult and the healthcare team. And an abilities-oriented approach improves healthcare encounters, share purpose, proximity, inclusion, empowerment, trust, and hopefully joy in what we do. So I want to show you one of the papers that was recently published describing these projects, My Abilities First. And this was published in the Journal of the Clinical Teacher in April 2020. And the paper is a brief paper describing, again, the introduction of using an abilities-oriented approach in day-to-day practice in education not only for students and professionals and health allied professionals, but the general public and school-age children as well, with and without disability. So our role as advocates to change the approach and the views towards disabilities. So I'm going to focus on some of the descriptions or the information about this project. And I have a short animation also to show you. So the idea is to create e-tools promoting an abilities-oriented approach. And this is like an innovative approach using low-cost technology and accessible to everybody and virtually, which is important today and in the context of the COVID pandemic. The aim of My Abilities First is to improve the healthcare encounters of an overlooked population, so people experiencing disabilities, and there are a lot of publications describing that people with disabilities are unsatisfied with the language that is used during healthcare encounters and the attitudes that the healthcare team has towards disability. And My Abilities First adopt a rights-based approach and help collect personalized health information. So My Abilities First consists of 3 educational web-based animations. They are targeting healthcare professionals, the public, in the general public, and school-age children. So there are different, like 3 different animations. The first one try to encourage the creation of My Abilities identification card, a sort of passport of abilities that should be included in healthcare encounters. The second one describes from a person with disability the expectations during the healthcare encounter and sharing a positive experience and a realistic description of what is living with a disability on an everyday life. And the third one is trying to educate the general public, including kids, school-age children. So hopefully you can access, these are open access animations and you can share them and hopefully you enjoy them. So I am going to show you a brief animation, one of the animations promoting the creation of My Abilities ID card.
Welcome to My Abilities First. Let's celebrate everybody's abilities. How would you introduce yourself? Would you describe your limitations? Or would you start with your abilities? Traditionally, services for individuals with chronic conditions were planned based on what was wrong and what that person could not do. Nowadays, Best practices are centered in empowering people to take a lead in their own data collection and care process. However, individuals with chronic condition report that they rarely experience an abilities-oriented approach as a foundation for interventions. This has to change. We need to focus on what a person can do, build upon their abilities, and help them achieve their goals. What is needed is a shift in the disability paradigm and how needs are identified. Policies, systems, and services, including assessments and interventions, all should adopt an abilities-oriented approach. How can we adopt an abilities-oriented approach? Okay, here are some ideas. Adopt My Abilities card. My Abilities card should be the first page of every health record. To build My Abilities card, ask every child, youth, or adult with a chronic health condition to describe themselves, describing their abilities. And major facilitators, create an Abilities electronic card. To build My Abilities electronic card, ask every child, youth, or adult with a chronic health condition to record a short video or audio describing their abilities. That person can choose to record the video and audio using his or her voice, or use the most comfortable way of communication. For example, sign language, or augmentative and alternative communication devices. Also, they can upload a picture or a drawing that best describes his or her abilities. Let's adopt My Abilities first card. Let's promote positive, empathic, health care encounters for all of us. Let's celebrate everybody's abilities. Thank you for watching.
And following the theme of the conference, we propose that using an abilities-oriented approach, it should be across the lifespan. What are the contributions and the significance of My Abilities first? And the next step, the idea is to create a My Abilities first application, an app that will empower children and families to take a lead in their own data collection and care process, using a positive language and the way that they want to express themselves, and working in collaborative ways on mutually agreed goals, and focusing on the abilities of individuals with chronic health condition is a meaningful starting point in supporting healthy life trajectories and consequently achieving fulfilling lives. Finally, I want to share some information about ongoing pilot using My Abilities First. There are a couple of projects going on, and some of them are just starting. One is in Taiwan, and professionals are using the My Abilities First as an educational tool in the physical therapy school at the National Taiwanese University. And this exercise has started, and I'm hoping that we'll have some feedback about satisfaction and the impact of using My Ability First in the curriculum of the PT trainees. And they are also planning to use it as creating My Abilities ID card in rehab community programs in some cities close to Taipei. And so I'm hoping we'll have some results of those as well. It's really exciting to see that people are willing to apply My Abilities First. And then there are a couple of initiatives in Latin America in different countries. And again, mainly using the educational animations as an educational tool for trainees and professionals. And there's a future planning for using the tools in clinical practice. So I invite all of you to check the animations and think about how to implement My Abilities First. This is an open access tool, And the most important thing is to see how that impact clinical encounters and attitudes and satisfactions in healthcare, both from professionals and from families and children and individuals with disabilities. So I'm hoping to get more results and share more information in future meetings and in future publications. I want to share some of the references, and I have a long list of papers that I'm happy to share with all of you. So we can go back to these regarding resources during the question and answer section. So thank you very much for your attention, and I'm going to invite my colleagues to share their presentation, and then we will answer your questions and share materials with all of you. Thank you very much.